Welcome to
Morning.
the Health, Human, and Social Services
Good morning.
meeting now. I would like to welcome, first of all, Supervisor Strauss, Supervisor Simpson, and Supervisor McDonald, and Van Zloo. How are you, sir? To our meeting. We are missing a couple, but we have a quorum, so we're going to start it up. I think what I'm going to do for our committee meetings is, I see your hand, is to have the departments that are from out of town go first, and then we'll have the locals go second. So, how can I help you, Supervisor?
I just want to express my gratitude for getting to sit on this committee. I've been chairman of the Support Services Committee for a year or so, but I've got a lot to learn, and I intend to make the most of my time learning at the feet of the Zen master of committee chairmanships.
Well, we appreciate that.
My sometimes favorite supervisor.
I love it. And one more note to this before we approve the meeting minutes. I am somewhat of a humorous guy, but Supervisor McDonald just brought it to my attention. Is it April Fool's Day, or is every page supposed to be exactly the same in this packet? I just perused through it, and I started cracking up there.
No, it's all okay.
Welcome, Supervisor Bramer.
Thank you. I don't know what happened. Mine are different.
That's pretty impressive.
Mine are different. Are yours all the same?
They're all the same, but it's okay with me.
Are yours all the same?
Mine are all different.
I don't know what am I looking for. Yours are all, okay, you know what, I had a packet of agendas. I must have made a copy of it.
That's too funny.
Here, who has the?
I thought you were trying to keep us on our toes for the very
If
first
you were
step.
really good, Matt, you could just wing it and you wouldn't have said
Sorry about
anything.
that.
I never wing it.
Sometimes you have to do
Always
that
play
as
by the
chairman.
rules.
Okay.
I'm writing that down, by the
See
way.
if we got it, you know, do it 6 times
All right,
over
this
and over.
is a different one. That's
A little
all
better.
different.
All right, so, now that we get that out of the way, the first order of business is to approve last month's committee meeting minutes. Motion made by Supervisor McDevitt, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. Okay. Christy Sable, take it over.
Okay, I have a few things, couple housekeeping, and then a couple of positions to fill. So the first one I have is resolution request form number 1 to appoint my advisory council. The rationale behind that is that it's mandated by the State Office for the Aging that I have an advisory council, and they're appointed annually.
Okay, motion to get this on the floor, Supervisor Strauss, second by Supervisor Simpson. For Supervisor Bramer and McDonald, a lot of these things are yearly appointments, etc. So if you have questions, you know, just obviously ask, but some of the stuff is just standard protocol.
Okay,
Okay?
thanks.
Very good.
Yep.
Any discussion? All in favor?
Aye.
Opposed? Carried. Okay.
The next is resolution request form number 20. It's a miscellaneous to request authorization to submit. This year is a 4-year plan to the state. It's a 4-year plan for services, but it's a 1-year fiscal plan to the New York State Office for the Aging. The rationale is, you know, if we want money, we have to submit this plan.
Okay. Motion made by Supervisor Vanslo, second by Supervisor Frazier. Any discussion on this? All in favor?
Aye.
Opposed? Carried. Okay.
Okay, resolution request form number 12 is to fill a vacant meal site cook position at the Bolton site. The position was vacated due to promotion, and each of the sites, obviously, you know, we need a cook to prepare the meals, and so this will do that. I am working with civil service on decreasing the number of hours at the site on a whole, but this is the cook position at 30 hours.
Okay. Motion made by Supervisor Strauss, second by Supervisor McDevitt. Supervisor Seaver, you can sit at this table if you would like to. Welcome. Okay, any discussion with this position?
Is there a person already
Yes. Mhm.
in
Yeah.
line? Okay.
Yeah, there's only 2 people at each site. So when one person leaves, there's always a person that would step into the.
But is there a person you have slated to fill this spot already?
Oh yeah, the person that's already there that was the manager position is going to move into the cook's position. Yep.
Okay, all in favor?
Aye.
Aye.
Opposed? Carried. Okay.
The next is another request to fill, and this is, the position of Specialist Services for the Aging in my office. Due to retirement, the person currently holding the position. I do have somebody in mind it's a specialist, position that we're filling, but there's an aging services assistant that will probably move into the specialist position. And then I will probably hire, and it does say backfill due to promotion, I'll probably hire an assistant.
Okay. I'm assuming funds are in the,
Yep, it's in the budget.
okay, we need a motion from Supervisor Simpson, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Chairman, I have a question.
Yeah, I kinda brushed over that though, didn't
It's the source of reimbursement is federal,
Right.
50%, and state 75%.
I saw that, that was $1.25.
Well, it's because, and I'll explain that. These positions, the nutrition program has several different funding sources, some state and some federal. So the percentage of her salary that is in the state code is gonna be funded at, 75. The percentage of her salary that's in the federal is gonna be, at 50%. So altogether, I mean, we're, not to get down into the weeds with this, but we're overmatched in the nutrition program anyway. So it's gonna be somewhere in the middle there, but there is reimbursement available for that position, if that makes sense.
Well, I think what he was getting at is that how
I'm
can you
over
get better-
125% now, yeah, but
Give me out.
different amounts are reimbursed at different rates.
Right.
There's not enough room on the form to go into the full.
So what she's saying is above your head.
Well, you can trust one of us to pick up on this, make a big deal out of it, so.
It looks like in the, I think it says various, when it says what codes is it coming out of, also on the form. It says list the budget code, and I had to put various because it comes out of several different codes.
You're just trying to confuse me further, aren't you?
No,
So the question is, are we,
you are getting money for it, if
we
that's the
are
question.
getting, but are we getting, if it costs $1 for a service, are we getting $1.10 back? Yes or
No,
no?
no, no, no,
Okay, okay.
no.
That would be $1.25.
Okay.
I was gonna say,
And that would,
Bravo.
and that-
$1.25.
and that would be
Peter.
impressive if we were able to do that. We already approved it, so pretty much this discussion is moot. Okay.
Time has passed.
Okay. Moving on, my final resolution request is to extend contracts under Title IIIB. Title IIIB is a federally funded program. It's kind of, a general office program. They usually automatically renew, but we had a couple changes this year, to the schedule, which is attached. We no longer have a contract. The town of Queensbury, is not providing transportation as their subcontractor, Community Action, is not able to provide transportation. So that's one change. And, the Warren County Council of Senior Citizens has disbanded. They were a contractor, and we will now be contracting with the town of Luzerne to provide the senior luncheon. So those are the changes that necessitated, bringing it to committee.
Okay. Need a motion to get this on the floor, made by Supervisor Frazier, second by Supervisor Bramer. Any discussion? All in favor?
Aye.
Opposed? Carried. Anything else, Christie?
No, that's everything I had.
Any committee members have anything for Christie?
Yeah, I just, maybe just bring something to the board. In sitting here talking with Christie, you know, I asked her one question, and that being, what's the biggest issue or the biggest problem that the Office of Aging faces, in terms of her effectively doing her job? And, she indicated that transportation is the biggest issue, getting people from point A to point B, and, you know, as we go forward, you know, maybe we all should mutually try to put our heads together, and maybe it's just volunteers and getting the message out and communicating to good people out there in the county that it's an issue, and maybe we need some help. So.
Okay, sounds good. Anything else? Thank you, Christie.
All right, thank you very much.
Thank you, Christie.
Okay, social services and countryside. I think we'll go with you guys next, please.
Yes, I didn't miss anything.
Should have done 6:30.
Did you print these all at your office?
Wherever you,
It's like he's been around.
It's like he knows what he's doing.
Well, they never match up with what you get when you guys are.
Yeah.
yeah,
But they're kinda.
What is this?
Got you a whole bunch of reports here.
well,
The back.
you know, what I said
That's
was,
the back.
Little
Oh, look, she's got something.
You have
This
mail,
one,
Oh.
you need to use it, I said, I'm gonna put that on.
this does match up. A lot of times they don't. Things happen between.
Clearly.
Thank you.
Yeah, I was just saying,
This is the details.
Okay, but this does have the attachment file,
I tried for a couple of years, and I print everything out, get here and get it all handed back to me. If I gave it back, I know it's still. I know, they still already printed everything out.
yeah.
Whether they do it or not,
Ad like that?
This is official right here.
That'll work.
Table got so long all of a sudden,
Backup information.
all these people. Things just go around in full circle, don't they, Dee?
Yep.
2006, I was working with Dee.
Now you're stuck with me again.
Yep, yep. Why don't we start with you then, Deanna?
Okay. The first item that we have on our agenda is permission to fill a cleaner position at 40 hours a week due to resignation and backfill any positions left vacant when we fill this one. And this is to help us meet Department of Health regulations regarding cleaning and housekeeping.
Okay, motion to get this on the floor, Supervisor Vanslo, seconded by Supervisor Simpson. Any discussion on this position? All in favor?
Aye.
Opposed? Carried.
The next item is permission to fill a laborer position at 40 hours a week due to resignation, and again, to backfill any positions that may be left vacant due to this. This will allow us to meet Department of Health regulations with regards to food service as well as maintenance coverage on the weekends.
Okay, motion Supervisor Stroud, seconded by Supervisor McDonald. Any discussion on this item?
I just wanted to ask, and I probably should ask for the last one too, these are already in the budget?
Yes.
Yes.
And they are 50% funded by the state.
Okay,
Thanks.
all in favor?
Aye.
Opposed? Carried, okay.
And the last item is our overtime report for 2015. We are slightly over the figure for last year, but well within range for the past couple of years.
Very good. Yes, Supervisor Simpson.
Before the meeting, I had asked you about the boilers, is there anything else you need from us?
At this
Are you-
point, no. Kevin Hadros was in yesterday, and he's going to help us do the specs so we can put it out for bid.
Okay,
We're working on replacing one of the boilers at Countryside due to the age and it failing, tripping on a regular basis. But we do have heat in the building.
That's always
good,
nice.
I wanted to make sure.
And I do have, I did meet with Cynthia last week to talk briefly about social services, et cetera. And because I already know Dee, what we have done in the past with Westmount, and I think we did a long time ago at Countryside, is, especially for the new supervisors coming in, what I would like to do is to host, and Supervisor McDevitt's been on a lot of these, but we'll host maybe a breakfast and do a meeting up at Countryside and let you guys take a tour over there, as well as social services. We'll do something over there in the coming months, so. Okay, Supervisor McDevitt?
I just had a question to you. In terms of a general occupancy, a couple of months ago, did we try to make a change to try to broaden the, was it the geography or the
Yes.
or the clientele?
Since then, we actually have not admitted anyone from out of county. The referrals that we have gotten for out-of-county residents, they've been too clinically complex for our facility. For mental health reasons, they just need more supervision than we can provide. But we are getting calls from outside of Warren County, which is a good thing. I also work with, thank you to Supervisor Seaver, I sent out letters to try to get us included with regional chambers of commerce, the county websites, or the town and state the town and city websites, so that we can do some more advertising. And we're also going to work on doing the little index cards that we had before, the postcards that we sent out to local residents to try to increase our census.
Thank you, Dee.
Supervisor Shaw?
Supervisor Sokol, could I make a suggestion and have our employees introduce themselves to the new people?
You can do that. It's probably a darn good idea.
Would that be helpful? Huh?
Yeah. So I'm Deanna from Countryside Adult Home, I'm the director up there, and I've been there for about 10 years now.
We did get to meet Deanna on our little orientation.
Okay.
I'm
Cynthia.
Cynthia Schrock-Saley, currently Deputy Commissioner and Chief Legal Counsel at Department of Social Services across the parking lot.
Julie Montero, I'm the fiscal manager at DSS.
Pleased to meet you.
And you are?
My name's Matt McDonald.
Nice to meet you.
I'm Claudia Brainworth.
They're both from Glens Falls.
Okay, thank you.
Thank you, that's a great idea. Yeah, in absence of Maureen, we have Cynthia, so go right ahead, Cynthia, take it away.
Thank you. I'll go ahead and start with our action agenda items. Our first resolution request is notice of intent to fill the vacant position of senior account clerk in the accounting unit. As you can see, there is a difference in the salary that the position was left at to the base salary of $30,959, depending on who the applicant and qualified person is. I'm sure there's a range in there somewhere.
Okay, so this is negotiable then, Cynthia? This is going to be a negotiable item?
I believe so. Julie can speak to that. It's her department.
If it's somebody brand new starting out, they'll start at the entry level, 30,000. We're kind of hoping maybe there'll be a little interest
Yeah.
of somebody that currently holds the position. So whatever grade they were at, they would do a lateral move.
Okay, okay. So we don't have a swing of any type of dollar amount?
My guess would be entry level.
Entry level, okay. Okay. Motion to get this on the floor then, please. Made by Supervisor Simpson, second by Supervisor Strau. Any discussions or, yes, Supervisor Seaver.
I'm just wondering, if we do find someone with a lateral move, is the max amount then going to be, you said 30,000, but the max amount will be the 36, because we won't exceed what's already there, or it could in fact cost us more?
It could,
Okay.
because they come, if it were a lateral move, you come over at whatever step you currently are.
So will you be at least coming back to us letting us know what it got filled at, like did it cost us more, did it cost us less?
Absolutely.
Okay.
Generally though, if the person leaves one position and goes up, the person that you hire for that position that they left starts out at the entry level, so there usually is some kind of a savings.
Right.
Okay. We have a motion and a second. Any other discussions on this?
This is also 50% reimbursable by the state.
Actually,
It's,
we're reimbursed more.
I think it's like 63, isn't it?
Oh,
Yes.
Yeah. Okay, all in favor?
Aye.
Opposed? Carried.
Our next four requests are with regard to training. The first one is for our New York Public Welfare Association upcoming conference, which is next week. We have 7 staff members to attend, including the 3 attorneys, and that's where we get our continuing legal education credit. So I have a resolution request for those 7 staff to be able to attend that conference.
Okay.
There's no overnight stay, it's in Albany.
Okay. Motion made by Supervisor Strauss, second by Supervisor Bramer. Any discussion? All in favor?
Aye.
Opposed? Carried. 3.
Number 3 is a resolution request to grant permission for Barbara Flores and Laura D'Amelia to attend the SNAP Training Institute in Albany from February 2nd to the 5th.
Motion made by Supervisor Bramer, seconded by Supervisor McDonald. 2 rookies. Supervisor Seaver?
I see here you have the overnight travel with the room rate. Is it because there's training that goes on into the evening that's just not worth the drive back and forth?
We do a comparison with regard to that as far as, you know, what it would take in overtime pay for them to be driving back and forth in Albany, compared to whether or not they could stay overnight. Usually what happens is, we encourage them to take the cheaper of the 2 options, but in the event that they would choose the alternate option, we typically do not pay the overtime for that. so the comparison that you see is the all-inclusive.
Very good.
Makes sense, I just wondered.
Okay.
Supervisor Seaver, where are you looking? I'm sorry. On tab 3, where am I seeing the?
It's on the back page.
On the back page. I'm actually looking online, but I'm assuming it's the same in the packet.
On the back,
It is, for this particular training, without, staying overnight actually is cheaper, $620.67, rather than, not staying overnight in the drive back and forth. You can see how.
See on the very bottom?
The
Yeah.
mileage is broken out.
Thank you. I'll get this.
Supervisor McDevitt?
Actually, this is the first time I've ever seen this comparison, and that's really nice. That kind of puts a little bit of, you know, credibility on the story that we were taking that into consideration. I appreciate that.
Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried.
Supervisor Sokol?
Yes, ma'am.
Can I just ask a question about the training itself? Supervisor Simpson and I both sit on the standing committee for MedPAC as it relates to Medicaid and social services, and one of the discussions, and we're getting ready for a meeting here on the first, I believe. One of the discussions we had back in August was about the proposed expansion of, both the SNAP program and the daycare, reimbursement and some other changes with the employment unit. And I'm just wondering, is this conference going to provide us with some additional direction and updates on that, or is there anything we need to know going into that meeting on Monday?
Well, the training is specifically for the employees to know how to handle those new changes. I mean, that's typically what any of our trainings are. With regard to this particular institute, they are gonna be working on the new, requirements for eligibility, the manual budgeting, the fraud referrals and recertification. There have been a lot of changes to that this year. So that's what they're gonna be learning about as far as what you need to know for your training. I'm not sure I can answer that.
Well, I'm just wondering, maybe Supervisor Sokol, this is something you could forward to us or approve forwarding to us, but just kind of a 101, here's the changes, here's what we need to know, because our job at that meeting is to advocate for, obviously, for you guys, and to be able to look at, you know, what are the realities in terms of the pros and the cons. But I think it would be really helpful for us to know your position as a county, and certainly you as chairman, Supervisor Sokol, so that we could be a little more educated and informed going into that meeting on the 1st. Would that be all right?
If you, can send me more specifics on your meeting, then I can pull up some of the ADMs that relate to that and share those with you.
I just need them translated into language we're gonna understand.
I'll do that in my spare time.
Well, I think it's important for the county.
Absolutely.
You know, we were very honored to be appointed to these committees.
Yep.
And I think it's something that I recognize. I don't think it will be hours of work, but something that we could
You agree?
be familiar with.
I haven't seen the agenda of what our training is, so I don't, have you seen?
Well,
Or
it's
the,
not a training,
the,
it's
I
just
don't
a
mean
standing
training,
meeting. But the last time I
meeting.
know, we both said that
Yeah.
we were kinda
Yeah,
taking a backseat to a lot of the terminology
Mhm.
and specific viewpoints for our own county.
yeah.
And I think it puts us in a better position to understand it.
I would assume we'll get a copy and then maybe we can
Yeah.
take that and forward it.
Word is on. There's resolutions that are active, we'll support them.
With regard to a lot of these particular eligibility, requirements, we don't take a position that's separate from what we're directed to do, typically. You know, we get the direction from the state, we're mandated to do certain things, there's very little leeway. So as far as, you know, taking a position, I would say our position would be, we're doing what we're told to do. But if you can forward to me your meeting agenda, I can certainly try to hone some information down for you, I think that.
If we send it on, they were very vocal, some of those ladies, about what they were frustrated with at the state level. And sometimes being directed to do something, and you know what the reality is on the ground, would be good for us to know.
Yeah, absolutely.
When is this meeting,
It's
Supervisor?
at 9:00.
First.
First,
Oh,
second,
fine.
yeah,
Oh, the
third.
first,
You know, there was they're advocating for an increase from 63 to, what was the number, 70? Or what was the original, I think there was a original reimbursement rate before the state started knocking it down, so that was a major part of it also, was the reimbursement.
Right. work for you, Matt?
I'm sorry?
Does that work for you?
Absolutely. Okay. Item 4?
This is a request for permission for our, newly trained, CPS caseworker Lisa Schmidt to attend the Sexual Abuse Dynamics Training in Rensselaer from March 2nd to the 4th.
Okay, motion by Supervisor Stroud, seconded by Supervisor Vanslo. Discussion?
Just got a miscellaneous question. When we figure out the overtime versus the stay overnight, if someone's a salaried person and not a per hour person, how do we figure that out?
All of our employees are salaried, so, they work 8-hour days, so any amount of time they need to work over 8 hours, they
But
do overtime.
how about an administrator that's salaried? They don't get paid by the hour, right? They can put in 60 hours a week. Maybe they often do.
Right, or more.
So-
No overtime.
So we still figure as if they were getting paid overtime, even though they don't get paid overtime?
No.
No, the caseworkers, do get paid overtime.
Yeah, okay, but for the people that are salaried and don't get paid overtime, would we still use the same formula or another one?
No formula as far as I know.
Okay,
So like this particular person, Lisa, she's hourly.
No, none of our employees are hourly, as far as I know. They're all salaried, graded positions according to the CPA contract. But they work 8-hour days, so they do get overtime according to the contract.
That's a union thing, I'm assuming?
thank you.
Supervisor Seaver?
To John's point, obviously, then if someone does not qualify in their contract for overtime, their salaries are typically higher to compensate for the amount of work and the duties of that position. So training and education is obviously part of that they know they're gonna entail that time.
Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried. Okay. Item 5.
The last, is a similar request for permission for one of our APS caseworkers, Ann O'Neill, to attend the Domestic Violence Liaison Training. She is our Domestic Violence Liaison. This is required of her from April 12th to the 14th.
Motion made by Supervisor Stroud, seconded by Supervisor Devitt. Any discussion on this one? Supervisor Seaver?
I can't, what page is that on?
It's tab 5.
And the domestic violence liaison, and correct me if I'm wrong, but I thought they were employed by Catholic Charities.
That's, we have a separate position that has been working in conjunction with our CPS unit,
Okay.
who is a domestic violence liaison. We do not pay that person. She sits in our office a couple of days a week, and she goes out on some, calls with some, totally separate.
Okay, so they're employed by a separate entity. So
This is one of our employees.
the domestic, this person is one of our employees requesting
Yes.
to go to a DV training.
Yes.
Okay, thank you.
Do we have a motion and a second on this one? We do. Any other discussion? All in favor?
Aye.
Opposed? Carried. Thank you.
The last thing that we have on our agenda, is two requests that I have. As the committee may know, the commissioner is out on medical leave. She left at the beginning of January. She's expected to be out, for approximately 8 weeks. Because of the significantly increased workloads and the unique organizational structure that not only we have right now, but is going on in the county with all the changes in the county attorney's office, changes in the family court system. I have two requests for temporary modifications in her absence. The first one is that, I am requesting a temporary salary increase to the salary level of the commissioner position. I have been doing 2 jobs for quite some time, and I don't think it was contemplated last year, when I accepted the second position, that, the workload was gonna be as significant as it has been. I can share a little bit more detail on that, but I think we've talked about that numerous times. All of the new changes, not only for the services, which I am in charge of supervising right now, but also for the eligibility units through OTDA and some of the other requirements that are coming down this year. I have spoken to the county administrator, Mr. Dusek, at length about this, and, given him all the reasons behind it. I have been working probably about 80-hour weeks the past couple of weeks, and that's not expected to get any lighter in the commissioner's absence. I do realize that part of my duties are to act in her absence, but I think 8 weeks is an extended period of time and possibly unreasonable for one person to act in 3 positions without getting some sort of compensation. We do have a new attorney that has come on board. He's only been with us for about 5 weeks now. He is still being trained both in family court areas that we practice in, which is going to be his mainstay, but also support. As you might recall, we took over the duties of the part-time county attorney, Amy Bartlett, and doing all the support matters. He's already appeared on 4 support hearings, in addition to numerous other proceedings, as well as other abuse and neglect. He is being trained right now by me on adult protective matters, such as guardianships. He's about to do a hearing in a couple weeks, and as well as access orders for adult protective. He's already worked on that. So he is continuing to be trained by me. We are extremely busy with regard to items such as what Supervisor Sieber brought up. Just so you know, one federal law that was signed in 2014 has created for our state and for the local districts at least 21 what they call programmatic deliverables, which means changes in the way that we do business, just for our children's services areas. We have been required at certain intervals over the past year to implement these changes, and it's been extremely detail-oriented and trying. I have one example. Right now, just in 2015, there were 25 administrative directives, and in kindergarten we like to call them must-dos, and 10 informational letters and 11 local commissioner memorandums. Many of them having to do with just that one federal law. This is 35 pages of one of those. So it's a lot of work. We've been doing a fairly decent job at rolling that out, but we are definitely in immediate need of doing more work on that. We need to have our casework staff, as well as the other staff in the eligibility units, properly trained in all of that. There are other areas, not just services, such as the areas that Supervisor Sieber brought up with regard to SNAP, HEAP, daycare, many changes going out. We need to make sure both our staff is trained and the people that we work with are trained properly. We were here the other night training some foster parents on part of this act in creating normalcy for children in foster care. So there's many different aspects to it. I'm happy to, if you come over to our office, talk more about it, or talk to anybody about those details at greater length, but right now I'll leave it at that. I think that as far as that position goes, we have done some cost analysis. The commissioner's position, as well as mine, are state and federally reimbursed as well. So we are talking about the difference in my salary versus the commissioner's position. It's a full difference of $6,704, reimbursed at 62%. Roughly, our DFS share would be, on an annual basis, $2,500, roughly. So with the reimbursement, on a per-week basis, the additional amount that would be added to my salary would be $48.99 per week. This wouldn't be retroactive. I'd be requesting it as of Monday, which would be the start of a new pay period. So if the commissioner were to be absent roughly 6 more weeks, we'd be talking under $300. And it would be covered by our budget. It wouldn't be any cost to the county, any extra cost. 6 weeks would be roughly $293.94. And that's, we're hoping at the outset, we're hoping that she comes back, prior to that time, but I would kind of take this request on a week-by-week basis to see, you know, how she's doing when she's fully able to be back in and taking over, her role. So that's my first request. I don't know if we wanna entertain that first, or if we like to do the other.
We can do them all as one. Yeah, you know, I just wanna add to this. I've been a long-standing member of social services, and I recall when we used to have hour and a half meetings about caseworkers and seeing some photos and trying to get help. I think the last year and a half, this department has come a long way. And I think now we have some cohesiveness there, and the flow is very nice, and I would hate to disrupt this. And after our conversations that I had with Cynthia last week, something like this I feel is a no-brainer. I hate to use that word, but you know, that phrase, but the work that she's put into this is intense, and for those of you who have not been on social services, it's not an easy department at all. So I'll open this up, if we want to do this all as one bundle, or if we want to do it separate. I'll take any suggestions. Supervisor McDevitt.
I would probably concur with what you're saying here. Listening this morning to Cynthia and her knowledge and her demeanor, particularly, I think is a step in the right direction. And I think it probably goes to what you're saying in terms of you know, addressing a difficult agency. I think the last year or two in the history of this agency have been somewhat maybe unusual. A lot of information in the press, a couple of issues which obviously we all know about. So the ability to get a handle on that, in dealing with very difficult human situations on a day-to-day basis, and having someone at the helm that has the ability to handle that, I think is significant and important.
Supervisor Suber.
I have a couple of concerns. One, obviously, I'm looking at the agenda. I don't see this as an agenda item. I understand that this is something that you're requesting then from Monday. It's on 6?
Number 6.
Monthly revenue and expenses.
No, temporary
temporary
personnel
personnel
issues and appointments.
I'm under the social services posted agenda, Warren County Department of Social Services.
I have an extra, if you want me to
I'm
take
looking
it.
at online. Has it been updated since it was posted online?
Not to my knowledge.
Does the rest of it match up?
What's the other, what is it? I guess I would just like.
But I think, putting aside the fact I'm,
That page you're looking at,
yeah, on the
right?
agenda.
Okay, flip it over.
Yeah, it's on the bottom, the last one.
Why is the temporary issues appointments, why doesn't it reflect it on the agenda page?
Rachel, it's on this sheet right here.
On the sheet.
I don't understand, you know, last year when we created this position, this was a concern. You know, could this position really do all the work that could be entailed? And then just a few months ago, we discussed whether or not, this was a tested position, was in the absence of, was a big area of discussion, at least behind the scenes, and I spent a lot of time on that. So I'm a little concerned that we're going to now look at increasing the salary to the acting, to the full commissioner's salary, even though it's reimbursed, we're still talking about money that's allocated towards the Department of Social Services. I guess.
Rachel, let me stop you for 2 seconds. Maybe Paul could chime in and give us some insight here as to what Cynthia's trying to do, and are we actually saving money in the long run by consolidating a little bit here in the interim?
Well, I just walked in, so I apologize. I don't know if you've covered the Case A supervisor yet, or no?
Not yet.
'cause that's part of what she's also suggesting, and maybe you need to hear that piece of it as
Well,
well.
and for Supervisor Bramer, we also wanna know the other positions that we're at, so this might be helpful. What you're
Can
going
you
to
talk
tell.
about your other requests, please, before we,
Yes,
so we
yes,
just
Leslie.
have a big the big picture of what
Right.
all is happening right now.
Right, I think that's what we need to do at this point.
Okay, for 1 second, Cynthia. Supervisor Simpson?
I think when we, formed that position, it was, she was gonna be chief legal counsel and be able to step in. I don't think it was ever anticipated that she would step in for an extended period of time and be chief legal counsel. So right now, under what I view this as, is we're expecting her to do a lot of legal work, all of the commissioner's work, and I don't think that position has ever been, sold as that was what we wanted to do. I think it was a temporary situation for a day out, or if she's, 'cause somebody's gotta be available 24/7. And that's the way Maureen explained it to me, is the 24/7, if she was sick or whatever, somebody's gotta be there to respond. So, as long as, my opinion is, for $48.98 a week, if that's in the budget, if we can swing that, I'm not opposed to that because of this extenuating circumstance. I think if this was, just because she did a couple of days, 'cause Maureen was sick, we might be viewing this as something different.
Well,
But
let's
for
let
2 months,
let's let Cynthia finish up.
okay.
Go ahead, with the other position.
With the other position. I'm happy to explain more about what I do all day, every day. The other position that we are requesting a temporary appointment on is with regard mostly to the services directives that we are required to implement, some of which we are having some difficulty with. We, have currently right now 3 children's services supervisors. I am requesting a temporary appointment for our current CPS supervisor to become what they call a grade A supervisor. There are many other counties, some quite larger than ours, some quite smaller than ours, some of similar size that have this position, in addition to a deputy commissioner and a director of services. This is not outside the realm of anything that has been done. However, Warren County has not had this particular position as far back as I could research with Ms. Menninger. If you want to know more about why I chose her, I can do that as well. But right now, we have an immediate need to be safe and compliant with all of these directives. The CPS supervisor, Tammy Breen, has been working at Warren County for nearly 18 years. She's worked in every children's services unit, foster care, preventive services, and CPS. She has even been a preventive worker in the schools, so she knows the ins and outs of all of these units. These children's services units are the ones that are most greatly affected by all of the new requirements. And right now, the way our structure is, I am the administrative director of services. So in addition now to all of my duties as what some would call acting commissioner, I'm still supposed to be supervising all of the services supervisors and casework staff in all these new promulgated regulations and statutes. So, that being said, I'm requesting a temporary appointment of her to this position, not to exceed 3 months. Gone over this again with the county administrator and with the civil service office. All we're doing right now is we're waiting for the approval from the state on the title of the position, since we haven't had it in Warren County. But the position would be to basically assist in the next 3 months with rolling out all of the administrative directives that we are required to be in compliance with by April. So that's the reasoning behind that request. Again, I'm happy to go into more about what I do on a daily basis and what she does.
What salary are you asking for her? And her name was Tammy Green?
Her name is Tammy Breen. I do have all the figures on that as well. Currently, her salary is at $55,924. Based on my research with this position in other counties and what the job duties would entail, some of which she's already doing, we would like to do the temporary increase to what would be equivalent of an annual salary of $59,000. That's a difference of roughly $3,076 annually. Again, this would be only for 3 months. It is also federally and state reimbursed at 62%. So our cost to DSS for 3 months would be roughly $292.22. And again, that should be covered by our own budget. We're not asking for any additional money from the county. Under $300.
Would this be retroactive at all?
No. Again, we'll be asking for this to start on Monday.
Okay, as for your request, you said something about we didn't need any additional money, and I think what you meant is there's already money in the DSS budget to cover your increase. It's still county money. I got confused. Because you said it was only reimbursed like 62% or something. Okay,
My apologies. We're not asking for additional money from the county savings to be added to our budget. We should be able to cover both of these requests, which, assuming that the commissioner would be out for approximately the full 8 weeks, which would be another 4 or 5 weeks, a total for both requests of under $600, $586.16. And again, that should be covered within our own budget.
Supervisor Seaver?
So what you're suggesting is that by combining these two temporary solutions, they would not exceed the period of the 3 months, I think is what you're
Yes.
suggesting. And if for some reason, there's an extenuating circumstance again, at that time we would convene again and discuss it.
Absolutely.
And I really think that, at first I know Tammy Breen, I know how hard she works, and I also understand the constraints that you're at, particularly the level of CPS, and I think, we could get a lot of information from her as well, going into our standing committee meetings, but, I think given the fact that would be temporary, and that it would not exceed 3 months, with that understanding, I would be supportive of it, but I do wanna know what the budget officer's position is.
I think we're talking pennies here,
Yeah,
Rachel.
it's not a lot of money.
honestly.
I know,
mean,
but he's still the budget officer.
Well, it's gonna have to go to personnel anyway next from
Okay.
here, so we can bring it up maybe there. I'm sure he'll be at the meeting.
Okay.
The concern, you can raise it there.
I just wondered, yeah.
Yep. Go ahead, Supervisor McDonald.
And for your temporary increase, is there a way we can receive some documentation of when her expected arrival date is going to be, just for the sake of the paperwork?
I'm not sure we can share that kind of medical information, but as soon as I know, you would know. And again, I mean, I would kind of take that on a week-by-week basis. When she's fully back, my temporary increase would end.
Right.
So it's possible that, she was given the general directive, I believe, of 6 to 8 weeks, which is what I believe she relayed to the county administrator. She's been out since January 6th. Unfortunately, prior to that, we overlapped days in and out almost the whole month of December, so there has been a lot of extra time prior to her departure that I have been doing that position.
Okay, so my suggestion would be to bundle these and move them on to personnel, if that's okay, and then we could maybe, Supervisor Vansel, you have a question?
I would just like to make that motion.
Okay.
I'd second it.
Motion made by Supervisor Vansel, second by Supervisor Simpson. All in favor?
Aye.
Opposed? Carried. Okay, thank you very much. Yes, Supervisor?
Just one, how are we compensating the existing, director? Is she on disability, is she on,
Medical leave, right?
Yeah, she'd be on sick leave pay.
full pay?
As far as I know, I mean, Maureen's been here for so many years, she's probably got an enormous amount of sick leave, so I'm sure,
Okay,
yeah.
all right, I'm sorry.
I
Yes,
have
Supervisor
another
Brown.
question for Cynthia, if that's okay.
Okay.
Just, you mentioned that the new attorney has taken over the support hearings from the assistant county attorney. Is it expected that that's to stay in your office, or will that be going back
No,
once
that's,
we get the county attorney's office?
that is staying with us.
Oh, it is staying with you?
We have also had discussions with the now acting county attorney with regard to taking back some of the duties with regard to juvenile delinquency and PINS proceedings, which is something that we were not expecting at all either. But because of the absence of their staff, that's another additional duty that we may be.
And Amy is saying their office is not gonna take it back once we get another county attorney, assistant county attorney.
Anything else for social services? No?
I don't believe so, just the budget. Thank you.
The budget revenue report for the full year 2015. Until next month, you're not gonna get a true picture because everything we pay in January is for December expenses. So the estimated, total budget, we average about 2.5 million a month. So if you add that on to our year-to-date, the 29,000,009 and add 2.5 million, you're gonna come fairly close to what you're gonna see at the end of the month, next month, once I do have January in there. Which should get us under the budgeted amount for the year. And same way with revenue, you're gonna see, that will be according to, the actual expenses as well. You're gonna see a little bit less due to not spending the full budget. But all in all, both of them look good.
Any questions on the budget?
And then there's a overtime comparison, and you'll see that we came in under about $300 less in 2015 than prior year.
Okay, questions or comments? No? Okay, thank you, ladies. Keep up the good work and keep your heads high. Next we have back from mental health. I'm sorry, Supervisor.
I think my last, social services meeting, or actually, all of my meetings last year were probably less than 10 minutes. And I just wanted to reference that, so.
Throwing that out there, right?
I guess I talked too much.
Thank you.
I don't understand.
Pardon? No, I don't need that, thank you.
Rob, we've got some new members. I'm sure you've heard the introduction, but this is Rob.
So I'm Rob York, Director of Community Services, Warren and Washington counties. I serve as the County Mental Health Director for both counties. My office has statutory duties under mental hygiene law for planning, oversight, coordination duties for 3 disability areas, for mental health, substance abuse, and developmental disabilities. We have a Community Services Board, which is also by statute, and we work with the Community Services Board, who reviews local services and approves plans for local services for those 3 disability areas. I have kind of a nice PowerPoint overview of our office and our community agencies that we work with. We have, I think, 9 different contract agencies that we hold contracts with in the community, local not-for-profits that you're probably familiar with. I have a nice PowerPoint. Maybe I'll do that next time, bring that, give an overview of the office and the agencies that we work with, our services. Our contracts are somewhere between $2.5 and $3 million per county. Primarily state aid. It's primarily passed through a state aid. It includes some federal aid also. We pull down some federal salary sharing. The county contribution is a smaller portion of our budget. That's sort of the quick overview. I see people have packets and access online, but I brought copies of my portion. Do I pass those out? Yeah.
Rob, is that PowerPoint similar to the one that you had the last time? Because that was helpful.
Yeah,
Very helpful.
I just need to update, the contract
Right.
figures, but it's pretty much together. You just pass those right down.
I came prepared, thank you.
Okay, and so that all took longer than my agenda probably. So I have one request, it's on the reverse side there, agenda, and that's just for a reappointment of, Holly Arian Sweet, who's a Glens Falls resident, to the Warren County Community Services Board. The term being a 4-year term, effective January 1 of this year.
Motion made by Supervisor Stroud, seconded by Supervisor Bramer. Discussion? All in favor?
Aye.
Opposed? Carried. Okay, item 2.
Okay, thank you. Just updates on our staffing. We have been able to backfill the program analyst position with Carrie Wright. Very pleased to bring Carrie on board in December. She comes to us from the Office of Mental Health, but some folks may know her. She previously worked for Warren County DSS. And she's a great addition to our staff, has a great breadth of experience, and we're glad to have her on board. We've also made a hiring decision on our Children and Youth Single Point of Entry Coordinator. This individual coordinates referrals for high-end services for mental health for children and youth in the community. And that person will be starting on February 29th. And Linda Wright, we were lucky to be able to make her an offer, so.
Okay, motion made by Supervisor McDevitt, seconded by Supervisor McDonald. Discussion, Supervisor McDevitt.
Just, Rob, just the second position there, children and youth, and maybe just, maybe a tad of background in terms of, have we in the past been fulfilling this need in our community? Maybe geographically, where this position will cover in terms of different counties, and maybe going back to the first point, trying to address this, and has it been addressed in the past?
It has been addressed in the past. These duties have largely been covered by our office. We have a deputy director who serves as single point of entry coordinator for adults, and is also doing it for children. The state has come out with some new requirements of us, and they made money available that we applied for. And so this position is funded with State Office of Mental Health funding. I think with the new duties, it was just too much for the deputy to add on, and that's why the state recognized that and made funding available. So I do anticipate that we'll be able to meet whatever new requirements do come down. But there is a tremendous amount of need in the community for children and youth related to mental health and the high-end services. So we're pleased to have an individual dedicated to that.
And geographically, will this
We'll cover both Warren and Washington counties. And for the new supervisors, you'll hear more next time when I do the presentation, but for our administrative office, the way that we're structured is there's a shared agreement with Washington County. There's an intermunicipal agreement that details it, but our administrative costs are split between the two counties. There's a chargeback once a year to Washington County for half of our administrative costs.
This second position is totally covered by state money?
Yes.
And the first one, is that already in the budget?
Yes.
Okay.
Yes, both of these positions are already, budgeted and approved.
And my apologies.
It's actually just
When you
operating
raised your
as
hand, Supervisor McDevitt, I just called on it as a motion, but these are just updates, so my apologies for that.
Okay.
Okay.
I get it.
And certainly if anyone has any issues related to any of these areas, feel free to contact me anytime. If you want to come out and see some of the agencies, see where we sit. We actually lease space from one of our contract agencies, the Association for Mental Health. And we're located on Maple Street in Glens Falls. We lease 5 offices there from them, and it actually works well for us because we can kind of go back and forth between the two municipal centers.
Rob's got a great location, and I think the offices are well done. They're very functional. I've been in there numerous times, and it just provides just a great service to both counties. So I think in terms of efficiency, streamlining, I think we're getting a good bounce for the buck in terms of the clientele that you serve.
And this has been pretty long and drawn out for Rob. Usually it's a minute and a half.
Wait till next time.
Yeah. Okay, anything else for, Rob? Okay, we have one more to go, so sit tight, public health.
I don't think we voted on that.
Yeah.
We don't have to.
My mistake, yeah.
No, mine was.
Wait a minute, did you admit to an error? Because I wanna know if
Seeing that
that's standard
my last
committee
one was in
chairmanship.
first grade and I was mistaken then. This would- Pleasure having you on my committee.
It's gonna be a long, fun ride, man.
How are you, Pat?
Well, we were a little paranoid that we got switched, but we figured we had time to save the day.
Absolutely.
Why didn't we have to vote on that one?
Because it was just filling the
agenda.
position.
Backfill.
We didn't have to.
It's already,
Here it just says
informing us?
update,
Right.
yeah.
Gotcha, okay, sorry, thank you. Do we need an agenda? Yes, please.
I think it's probably, I think we did it once already, I think, yeah.
Ron's not on this committee anymore?
Want me to-
I just noticed when the gals walked in.
The Conover report. Sorry.
He doesn't need one, he's prepared.
That's right. I get a check plus for the
Obviously,
day.
that's to do with, but all these.
Further north you come, the better prepared you
Oh,
are,
yeah.
huh?
And we're
I
just
just
doing
had
it
a few
from
minutes
the
before
computer.
I left.
Yeah, we have to actually,
Good friend.
Billing is in, but there are.
Okay, Pat, we have many new supervisors on the committee, obviously, but two new incoming supervisors are Supervisor McDonald and Supervisor Bramer, both from Glens Falls.
Hello.
Supervisor Stroud had given the recommendation of introductions, so if you guys don't mind just giving a brief, introduction.
I'm Sharon Sheldon, and I'm the Assistant Director of the Certified Home Care Agency.
I'm Tawn Driscoll, and I'm the fiscal manager.
I'm Janelle Jones, I'm the Assistant Director of Public Health.
I'm Pat Auer, and the buck stops here, I guess.
And I'm Tammy DiLorenzo, I'm the Clinical and Fiscal Informatics Coordinator.
Thank you, guys.
We would also like to, extend an invitation for any of you any time to come and visit our department. We'd love to show what we do. If you come early in the morning or late in the afternoon, that's our biggest beehive time. If you come in the middle of the day, you won't see so many people because they're out and about doing what we do, but we certainly would like to see you. And our annual report is also posted on our website, and if you'd like a hard copy, we can certainly do that.
It's great reading.
Great reading, okay.
Yeah. Mr. Sokol knows because he's read it page, word by word. Okay, the first, thing we have on our action agenda this morning is to authorize an acceptance of a $2,000 one-time grant from Adirondack Rural Health Network, and also we'll need to do a budget amendment when we get to that. It's just a one-time thing, and it's gonna be for initiative to do a prevention activity, and we don't turn down money, and it's an easy enough thing to accomplish.
Motion made by Supervisor Strauss, second by Supervisor McDonald. All in favor?
Aye.
Opposed? Carried.
The second thing, we would like to request a resolution to authorize Lynn Rodriguez, one of our nurses, to receive reimbursement as allowed by the contract for a job-related course. You can see I wrote it down and the information was transmitted. If she finishes the courses, and the courses came with your transmission, there's 2 or 3 of them, and we would only pay as she completes them. But the total amount, assuming she completes the whole thing. But it's a good thing because reimbursement is tied to coding, and if we don't put the right codes, that compromises how much money we get paid for our services.
Okay, motion made by Supervisor Simpson, second by Supervisor Vanslo. Any discussion? All in favor?
Aye.
Opposed?
We also, we would like to request a resolution to reappoint the members to our, Professional Advisory Committee, and you have, in the information that was transmitted to you, you have all of the members that are on that committee. There's no changes for this year. And there'll be a copy with the minutes, or if anybody wants to see it today, you can certainly do that. But it has to be appointed every year, according to New York State Department of Health.
Okay, motion made by Supervisor Strauss, seconded by Supervisor Bramer. All in favor?
Aye.
Opposed? Carried.
Okay, moving along, we also need to request a resolution in that same vein to appoint and reappoint members to the local early intervention coordinating council for this coming year. We have a new parent member because when the children age out of the early intervention program, often their parents age out with them, so we replace them. And Prospect School is no longer going to be sitting on the committee because they don't, since they merged with the Center for Disabilities, they don't provide early intervention services anymore. So the person that we had in that capacity retired, and they're not looking to have a replacement.
Okay. Motion made by Supervisor McDevitt, second by Supervisor Frazier. Discussion? All in favor?
Aye.
Opposed? Carried.
Okay. Tom, do you wanna do the budget amendment?
Attachment number 5 is a budget amendment for $2,000, which Pat had just said it with the Adirondack Rural Network. I believe it was for fall prevention, right, was that was grant? It expires 3/31 of this year, so, Dan Durkee's been working on that. And so it's for $2,000 for that revenue and expense line to amend the budget there. I don't know, do you do them separately or do you do them together? Do the amendments together? The next amendment, which is attachment 5A, is for $1,769.95. We, had one of our cars in an accident, not our fault, and this is the check that we received from the insurance company to pay for the repairs, which we're in the process of doing that now because I've received the check, so we just have to amend the budget to accept these funds.
Okay. We can clump these both as one. Motion made by Supervisor Vansel.
Yep.
Second by Supervisor Bramer. Any questions? All in favor?
Aye.
Opposed? Carried.
Moving on to our pending items, for those of you that were here at our last meeting, we discussed, the issues that we, had with our 2013 Fiesta vehicles, and, we've been working to try to get that taken care of. We've been working with the DPW shop supervisor, and he has driven, with the people that drive those cars, every single one of them, and, I've been in contact with the administrator, and Paul, you have some information that you're...
Sure. We have about I think it's 5 or 6 of those 2013s. The issue is the transmission on those vehicles. Fortunately, they're all covered by warranty, just so you know. They're still within the warranty time frame. But Pat's staff had taken them into the shop, and they've been trying to get them fixed, and they were dissatisfied with the results. So, as Pat mentioned, what we did is we put together a plan of action. The first plan of action was to have our DPW shop guy actually drive the cars with the nurses, because we wanted to have, better explanations of exactly what the problems were with the cars that we could give to the dealer. And it's no reflection on the nurses. It was just that we wanted a mechanic talk to a mechanic, you know what I mean, to have that so that they both could talk on the same wavelength. And some of it is, with these cars, the dealer has explained to us, is that these particular cars that came out from Ford are actually manual transmissions that are shifted electronically, so they seem like they're automatic transmissions, but they're really not. They're manuals with electronic shifts. And so, kind of an interesting phenomenon. But what they've been doing is that when they change gears, sometimes they give it like slipping, like a vibration, and sometimes the nurses have felt uncomfortable with them as they try to pull out into intersections, things like that. So we take this very seriously, of course. We don't want anybody driving a car that is not functioning properly. So we did the step, as Pat mentioned, and in fact, this week now, we're starting with rolling them through the shop with Niemer. He's advised me that what they'd have to do, according to manufacturer's directives, is they have to run a test on the vehicle. And if the vehicle fails that test, then they're allowed to replace the transmissions or the parts that need to be replaced, I guess. So we're going through that phase now. If we're not satisfied with that, we intend to pursue this with Ford representatives, whatever we have to do, as our first action here. The second thing, if that doesn't work, then the third phase of the plan will be, if we're still not satisfied, the third phase of the plan will be to turn these over to the county attorney and see if there's any chance that he can pursue something under the lemon laws of New York State. I don't know if there's anything there or not, but that's down further. I don't want to necessarily prejudge that they're not going to be able to fix them. Maybe they will. And certainly we have to give them that opportunity to do so. And then ultimately the last phase of our plan is not to buy anymore. So we do have that in the works as well. So we do have you know, a multi-step plan in place, and we just wanted to make sure everybody here knew about it, because undoubtedly you may hear some complaints or some issues with regard to these cars. And we do not, certainly if we feel a car is not able to function, now, like some of these cars have vibrations, but the shop, our shop guy said you can still drive them, they're safe. But any car that we feel is not safe, we certainly would not force anybody to drive it. We would give them another car from our fleet or our pool or something like that, while we're trying to get all this taken care of. So that's where we are with that. Hopefully next month we'll be able to update you further on where we're at.
One of the things that the shop supervisor said, is whenever, the nurses have an issue with cars, the immediate thing that you think about is women drivers. And the good thing is, when they went to the shop, he agreed that there were problems, you know, that they weren't making it up. So certainly if anybody feels not safe, but when you just go and it won't go, or if you go into traffic and you're not comfortable with the car, that's a scary feeling.
Right.
So from our end, you know, we don't want anybody getting hurt.
Our first car did go up this week, just to let you know, so they're doing it one at a time. So they've taken the first one, and we'll see how long that takes for them to repair it.
So you're not necessarily looking at anything for us right now then, Pat, right?
No, I just didn't want I didn't want to lose track of it, because
Right.
we did say last month we were gonna follow up.
Okay.
So we did do the next step, so.
How long would it take, Nemr, to, you drive the automobile up,
Well, one went on Tuesday.
Couple hours, I mean, half a day,
No, one went Tuesday, they haven't even gotten it back yet, so we're gonna take a while.
So is someone, do you think, working on that automobile for that period of time?
Probably not.
Yeah, seems like a long time.
We're gonna be monitoring that, just so you know, Supervisor. I have left my name as a contact person, because of the frustration Pat has had. I have spoken directly with the manager down there, and, I will be following up on each and every vehicle personally. My understanding in talking with them preliminarily was, there is a two-step process. The first is this testing phase, and then the second, if it fails the test, then we'll have to have another appointment, if you will, to be able to have the car repaired. So there is a two-step process.
Okay, thank you.
Supervisor Brock?
Yeah, my concern is, do we have a replacement plan for this? Because my concern is that, say they fix the transmission, and then a year or two later, we go right back to square one if the same problem isn't resolved. You know, it sounds like we could just, you know, get rid of it.
Well, actually, that was our final phase. If everything else fails, we may, and we're still not satisfied, we may end up trading them in.
Well, even if we are satisfied, but the thing doesn't, you know, if they replace it with the same transmission, we're looking at a problem in a year or two.
Well, this is something we would go through Julie, right?
Right.
And we'll be buying hybrid vehicles.
Big bucks.
We'll come up with some consolidation plan to save money
I like that.
on buying a fleet of hybrids.
Historically, just so, we usually keep our cars for about 10 years. And we have, you know, pretty
Yeah,
good
these aren't
amount
that
of
old.
miles on them.
2013.
2 years old.
Yeah, that was part
That
of
was
the
our
concern.
concern.
Yeah.
Okay.
Moving on to information for discussion, you'll see our emergency response plan, attachment number 1. We do those reports every month because we have an emergency response grant that we just report on activities that have taken place during the month. If anybody has any questions, you can certainly let us know at any time. Moving on to status of referrals, you can see the numbers that we transmitted to you also. I didn't give you that in the.
Comparing,
Okay, go ahead, yeah.
comparing our numbers since we've had competition within our certified agency, from 2013, I didn't print out on this report that I sent to Pat, but comparing us last year, we were down 7% from our overall referral status, and this year we were down 3% from last year. However, if you take those two together, we're down a total of 10% since 2013, which in doing business it's minimal. We still have a very strong referral source from our acute care and our area physicians. Where we're losing some of our referral status is from Albany area, which wasn't a huge amount, a huge percentage, but a lot of them are in the ACO organizations, and they now have certified agencies that can serve the hub of Warren County. It's a small number.
Okay, Tom, moving on to,
Attachment number 2 are our current financial status, as of the 19th. It's reflecting obviously still 2015, which isn't closed, but it will give you an idea for preliminary. Our revenues are lower than budgeted and our, expenses are lower than budgeted, but we haven't closed, and we also know that usually we may not meet those. Again, if we don't meet the revenues, we're not gonna meet the expenses. The expenses usually reflect with the revenues. So, our impact should stay the same or below what we budgeted. That's our goal, to make sure that that stays. Below, we've been asked always to reflect payroll, so we can get an idea of where our payroll stands. You'll see overall payroll is maybe got a few more adjustments to it, but this is pretty much what the bottom line is. You'll see that we were down over $62,000 in our regular salaries, but up in our part-time salaries, and that's primarily due to some positions that we had, full-time positions that either left or retired, and we're trying to fill them, and per diem have been helping us pick up that slack with referrals with nursing. So you'll see overall in the whole year, we were under $33,522 in salaries in total. Attachment number 3 is our comparison last year at this time to this year. What I did not take last year's meeting because it really wasn't final, and I just wanted you to see where final 2014 was, and compared to where we are now. You'll see we're below in a little bit. Again, we have 2 more batches of accounts payable that still get paid, and we'll bring into the expenses, and we still have revenues that we haven't reflected here. One of our big revenues is, I've noted, is our preschool program. That, we usually don't get the reports from the state till around March, and then we can prepare that, and we can put all the revenue for that. So unfortunately, we have a couple months more to go to get the final numbers, but that's one of the big ones that we'll be seeing. I guess that's it.
the people that have been on our committee before know that this is the same verbiage we use every year at this time, that we can't close our books perfectly on December 31st. We have to wait for some catch-up, so we'll hear this for the next couple of months, but we're feeling perfectly fine and optimistic. In the end, it'll all be fine. That's pretty much all we have.
Questions or comments for public health? If not, motion to adjourn. Motion made by Supervisor Simpson, second by Supervisor McDonald. All in favor?
Aye.
Opposed? Carried. Thank you, ladies.
Once more.
Thank you.